and it's very strange for me. And excuse me, but I prefer that. Ah oui, I have to. Il faut que je partage. Pof. Do you see my presentation now?
Yes.
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 Everyone.
Your presentation.
Okay. Voilà. Donc my interest, and it was the reason why I began to interest me about osteopathy. It's for breastfeeding, and I'll explain you why. I'll try to explain you. The idea to offer osteopathic care to help breastfeeding came from a combination of several experiences and long observation of the mothers and the baby in the maternity. I came across osteopathy by hazard, as I was suffering from pubalgia, and a colleague, a doctor specialist in functional rehabilitation, seeing me limping in my hospital at this time, suggests me a consultation with one of his physiotherapists without mentioning her specificity. I discover a type of treatment and its name at the end of this first treatment. After this woman manipulated a very large number of joints, and the problem was the only one joint she doesn't touch is where I was algic. Okay, the only one she doesn't touch is the pubis, and so I was extremely surprised at this moment because after this consultation, this first caregiving, I can run as before. No pain, no more pain. And this surprise, very big surprise, make in my brain, in my mind, a lot of questions. And since this moment, I read and I meet a lot of books and a lot of practitioners of osteopathy to understand why and how osteopathy is efficacious. I don't know is what the effect by the ways, and the first problem is the anatomy. The anatomy is very, very, very important to know, and in France, it's evident that a lot of doctors, as I was, don't know very well anatomy in the details. It's very important to know anatomy. With a lot of experiences in neonatology, I organized when I come back in Bordeaux in 1996, and at in the year 2003, I organized osteopathic treatment in my unit, and during 10 years, 12 osteopaths was practicing in neonatology with a good satisfaction of the nurses, and the parents. And there's never problem during 10 years. It was stopped because of political problem in our hospital, but not because problems about osteopathy. In the physiological postnatal unit, observing the difficulties of lactation, I looked into the reason for the failure to help the mother when the pain generated or the inability of the baby to suckle correctly led me to understand that these difficulties are related to a painful, including uncomfortable state of the baby, not allowing him to find an adequate position to suck quietly. In the same way, the mother who is also in pain does not find a way to help her baby to find this adequate position, and neither do the professionals. And it's an evidence that the baby and the mother and the professional together don't find the good position to make the baby sucking correctly. And this problem make me give my decision to do to train in osteopathy. But how to treat this pain and or discomfort? The pharmacological treatments are ineffective. However, if you look at the baby, pain scores are quickly extinguished in skin-to-skin position. The pain is intense again when the baby is placed on the back on a mattress. This pain seems to disappear as soon as the baby is placed on the stomach, but observation shows that in this position, he can't settle down using his supports. Could it be simply contractures? But there are muscle fibers in every anatomical structures except bone, muscles, fascia, including meninge, artery walls, artery veins, and nerves. And even there is myosin in the cytoplasm of all cells. And it's the reason why I said it's important to know anatomy, big anatomy, small anatomy, and the smallest anatomy is cell biology. It's important because there are muscle fibers in all these structures. What prevents relaxation? Retraction secondary to ankylosis in utero, babies cramped in the uterus, especially if they are lowered into the pelvis too early. Contractures generated by the protective reflexes during labor, more or less accompanied by instruments or manual holds applied by the professional in the delivery room. This protective reflex can be difficult to let go because of an emotional or mortal context complicated by a mother in the same states or disconnected from her baby by events that are worrying her. Generally, the effects left by these events remain unconscious and therefore ignored and not treated by the patient herself. The same is the same for the baby. If you don't know what you have, you can't treat. Having understood that, osteopathy is a way to treat this phenomenon, I decided to train this specialty. I am late in my slides. During the 10 years we have organized osteopathic treatment in my unit, you have made some evaluation. And in my work too, in the suite de couche, in the postnatal unit for the mothers and the baby, I have made some evaluation. The first was in neonatology. We compare before treatment and after treatment pain scores, heart frequency and respiratory frequency, and the most variation, the most significant variation was the respiratory frequency, and it's First idea about relaxation. If someone is more relaxed, the frequency of breathing is lower, as in meditation and so on. At each evaluation, the problem was we have no control group. It's only evaluation. But all our evaluation was always in the increasing the signs of health every time. I made a first evaluation in the maternity of my treatment after my training. And another colleague observed all these treatments, and we compile for the diploma of osteopathy of this colleague. The criteria, inclusion criteria, was difficulties to suck or painful breastfeeding. We measure pain after and before and after treatment, and we follow the first months of breastfeeding. You have on this slide the results, and effectively the difference is significant, but same problem as earlier. No group control because it's only an evaluation. What is important is to see that all the mothers speak about what remains in her memory after this treatment, and the main words is the best connection with the baby, better understanding of the baby. It's a leitmotif, very important. All the mothers say the same, and it's different of the what everybody talk about osteopathy. It's not only a joint problem, it's larger than that. I made a second evaluation because we can't do this treatment every time because we less time. As today, I can't look at the seminary this morning because I have too much work, no time sometimes, and some mothers keep the maternity with very, very painful breastfeeding, and we follow 50 mothers. J'ai sauté, voilà. Sorry, I miss one slide. Donc this second evaluation, but what's 50 women include because pain score very high. Remember that fracture, je sais plus comment on dit. It's the same pain as delivery, and at each suckling of the baby, you understand it's difficult to maintain breastfeeding during a long time. At 1 month, half of the mothers have taken their baby to an osteopath, and the breastfeeding was present for 92% of these mothers. The mothers who have not taken their baby to an osteopath, breastfeeding only 15%. I think the same for my first evaluation. And these two evaluation explain the last slide at the end of the talk. It's a proposition of randomized study with a number, adequate number to include. I want to explain you what is osteopathy. C'est la slide. Combien? I said I read my talk, and in reality, it's difficult to write too because it's not my. I don't like that. Osteopathy is a complementary medicine and for me, not an alternative. And I think it's a real problem to speak about osteopathy as alternative. It's not alternative. Conventional medicine treat organic problems, and osteopathy treat functional problems. It's not the same. And in conventional medicine, treatment of functional problem are not good. A lot of side effects, no effect, positive effect, or low positive effect, and conventional medicine is very, very, very strong for big problems. And there's a place for everybody. Functional problem, osteopathy, acupuncture, mindfulness, mindfulness, I don't remember the word, MSBR, with Kabat-Zinn, you know, meditation for others, okay? All of these problems is for functional problems. Organic problems is for medicine. It's very important to understand that and not try to mix these two problems. I think it's very fundamental, extremely important. Osteopathy was founded by Andrew Taylor Still in the USA at the end of the 19th century. And at this moment of the humanity, the conventional medicine was not very, very strong, remember? And it's explained why the osteopathy is more important in the United States than in France or other countries in Europe, because it's a beginning in USA, and the construction and the organization of the training is again at the same time of the organization of the medicine in USA. And you see the two arms developed together. And the reason why there's a lot of passerelle, I don't know the word, between the two specialties, the two way of to look of the health, because they increase the growth together. It's very important to understand that. And in the United States, osteopathy is an arm of the medicine, normal medicine, and you can change of arm. Okay, it's important to know that. And French doctors don't know that, and I don't understand why. It's only interesting to read what's happened in other countries to see that. In Britain, the organization is as in USA, sorry, but later, and the organization is non-medical, okay? But the organization is very, very, very strong, very serious, and for a long time, it seems to me it was about between the two wars of the 20th century. And the other pays, it's very, very variable, very high variability of organization, and it's probably one of the problem of the osteopathy in the world. In France, most of the professional learn and train osteopathy in USA and or Britain, and come back with a diploma, okay? And the word, the acronym DO, it's an ambiguous word because diploma of osteopathy, it's ambiguous. Doctor of osteopathy, point d'interrogation. You see the problem. And the beginning of osteopathy in France was very, very late and confidential at the beginning. The first school of osteopathy in France, the training courses was 7 years. And when Europe organize the learning in all of Europe. You know that's 7 years corresponding to doctorate, and 5 years master, 3 years license. You know that, and 10 years is very dangerous for the others in France. And there is an action to decrease the duration of the osteopathic training to 5 years. And with this decreasing of the duration, it's not possible to get the title of doctor. Okay, the last decrease was in 2015, and the number of schools increased extremely rapidly. That makes that there was too much osteopathic professional trained, and the level decreased very rapidly because there are not enough teachers to learn to the students correctly. And the reason why there is a very high disparity of the level of the training between one and the others. You understand? It's very, very, very large. There are five osteopathic principles. It's important to understand it's very different that conventional medicine regards. There is an interaction between structure and function. There are strengths of self-healing. It's possible to progress alone, to guérir. I don't know the word in my area. Body wholeness. The body is an unity. It's very important. The artery is queen. Vascularization is essential. And the patient, we talk about the patient and not the disease. The health of the patient and not the disease. No, you know, at the beginning, it's a different regard on the body. The first level of the training is osteoarticular. It's to begin to learn, begin to train, to understand in the end how is the anatomy. And it's not the same to see anatomy by the hands and by the eyes in a book. It's not the same. And we learn in medicine anatomy on books or on corpse. There's no more life in this body, okay? And the body is not the same during when it's a corpse than when a man alive. It's very different. I show you after a photography of what's happened under the skin. And the most important problem with we look for in osteopathy at the beginning is neuromuscular regulation. The principle is the gamma loop. It's a reflex, medullary reflex, and if there is a stimulation, it provokes a contracture, and this contracture, the aim of the contracture is to the protection of the body, okay? And it's important to understand that more is brutal or unexpected the event, more is the destabilization. After the event, the problem, the regulation, self-maintain, and at each level, you are an increasing of an amount of self-maintain trouble of regulation, and during after time problems, there's an accumulation, and the pain appears after some problems. It depends of everybody. The problem is no return to the previous balance, and the perfect balance it's important to understand that at this moment, the perfect balance is the egg or the embryo in the uterus of the mother when there's only water around him. It's the perfect balance. And after, a lot of events interfere and there's an accumulation during the life. I show you to remember what is gamma loop. It's first principle of regulation, medullary regulation of the tone of the muscle at each level of the summit. The organization is around a summit and centered by the nidus in the disc, intervertebral disc. From that, there's a lot of techniques, possible techniques. Everybody knows the thrust. High velocity, low amplitude is a focalization of the articulation at a point with restricted, and it's possible to get an impulsion, very, very rapid, but very, very low. And the regulation is disturbed, and the brain is in the obligation, and I don't know the word, I hope you understand, to create a new balance. And most of the time, the new balance is a best balance. There's other techniques. They begin to be more soft, more small, and more precise. The myofascial release direct says in the balance of an articulation, there are a lot of movement, and if you compare rotation in one sense, rotation in other sense, there's an asymmetry. If the joint is correct, is perfectly in a good balance, the rotation is the same in the two sense. And if there is an asymmetry, there is a problem. And it's possible to get a new good balance. Two sense. Direct is in the sense of restriction, and stillness support is to go to the more easy sense. And we put the joint in the position to maintain in the position, and the neuro regulation is in the obligation. I don't know the word. I don't think the word before. To create a new balance in the best way. Necessity. Well, yes, it's a good word. Yes. And the last level is called for by the osteopathic professional listening, and we use this term because the ends in our society are always to do something. The use of the ends by a good osteopath professional is to listening what happened in the mind and to do nothing. And it's the more difficult problem because it's not natural in our kind of profession at the beginning. I show you how are the tissues, the live tissues under the skin. You see a fascia, and you see the tissue between the fascia and the skin when the fibroscope enter between these two things, and you see there is a continuity, there are no disruption, and you see the fibers with some polyhedra okay, if you look at your skin very with a big attention, you will see on the skin the same kinds of polyhedra. Each polyhed is different than the others, and when we make a movement, we provoke movement of this kind of structure, the deformability is easy, and after the movement, there is a comeback at the initial position. It's very surprising, and if you want to see more about that, you have only to look at Gimberto Jean-Claude on the internet. A lot of video to see. It's important to understand this kind of tissue on when the patient is dead disappear very rapidly after the death. It's very important to understand that. No more. And when we learn anatomy at the faculty, we never see that. They don't exist because there's a lot of water, and after death, no more water in this structure. The structure disappeared. In the corpse, alors we can think about articulation. Everybody thinks about bones, but muscles with the bones, muscles against muscles, visceral organs between them, between bones too. All is possible. And what is important, there are no vacuum in the body. There is continuity, and you see that no vacuum, only water and fibers. It's important. Ultimately, all our cells come from the same first one. It's an ovocyte, okay? And it's important to remember that. The principle of treatment can be applied to all structures, articulation, joints, viscera, skin, brain. Brain can be considered as a viscera, and the fascia, very important, and the meninge are a fascia. All the fascia are continuous from meninge to peritoine. It's the same tissue in continuity. There are no rupture, no and no vacuum. To be knowledge of anatomy, it's important to be able to focus on the right place of each part of anatomy. And if we don't know anatomy, we can't do that. It's a real problem. We can treat a group of organs or even all the body. So it's very important to achieve wholeness. Remember the principle. Je sais plus où je suis. I have time to continue. Oops. Sorry. On this slide, this allows us to evoke the change of plane in the treatment. The osteoarticular, the tissue with the visceral and also cranial approach is in the doing, correcting something, but this implies a judgment on the apparent reality that presents itself. The reality that comes in our hands. This reality is in fact only a personal interpretation of reality. That's what I see, but it's no way reality. We never know the reality. We only every time we are in the interpretation, and it's a problem. Biodynamic osteopathy, which is interested in the evolution of the being since fertilization, with its forces that animate its development and growth, sees the globality as if the body were a gigantic cell with its history and its form, each one being the witness of the other interaction of structure and function. The structure in extenso, the form, has been developed by or for the functions, and the function modifies the form. Someone who play pala or has big hands after 10 or 20 years of playing this sport. Someone who do small things have small fingers. It's an evidence, but we never talk about that. The principle of therapeutic effects is to remain a pure observer, stable, calm, without focusing one's attention but seeing everything or almost everything. That is to say, perceiving everything or almost everything. This way of perceiving allows the patient to become aware of what he has to correct, and it is he who uses the stable and serene supports to heal himself. The patient uses the professional, and it's not the professional who has to do. It's only important to be there, and it's important to see all, but to do nothing. And it's very difficult for everyone. There is a very different concept from medicine. This is a very different concept, and it is a translation of the first principle, health and not disease. For the forces that repair the body naturally are the same force that built it. They are called embryological forces. These forces have been visualized in the research carried out on embryology, Eric Bleichschmidt, Jab van der Waal, but also by the surgeon Jean-Claude Guimberteau. I see the photography earlier. The modus operandi is to be, as a carrier, in perfect balance, ready to receive modifications of the balance to rebalance itself automatically. It is the same principle as those used in martial arts, calm but mobile balance. This balance must be thought of both physically but also mentally and emotionally. In this balance, the supports proposed to the patient allow him to rebalance himself, even of extremely discrete but not necessarily harmless imbalances. It is often the details that makes the difference. Think of how a grain of sand can block an enormous mechanism if it is placed in a key place. Small is more important than big. It's difficult to accept. To achieve this balance, we need a perfect physical positioning according to our structure at the moment as it is, and a totally neutral, benevolent, and non-judgmental mental and emotional positioning, just like in mindfulness meditation. This is what allows for optimal perception of the slightest imbalance. A perfectly balanced beam can topple over if a feather lands on one at its end. And you see this schema. It's important to see that the professional is very, very stable, quiet, and in the same position when you make mindfulness meditation. It's a very identical. There's 3 perception levels. Somatic correspond to tissue, fluidic correspond to emotions, and I show you one publication very recent about the movement of the cerebrospinal fluid. That it's important to understand that we feel in our hands this kind of movement, but there are no technique to be able to show these oscillations. But now, with the progress of the technology, it's possible to see, and it's important to understand that finally the hands are very, very, very important, very smooth, and very it's able to feel very small things. And it's a real problem that made for the other the difficulty to understand. And aerial is equal to mental. And it's very simple in the end, but it's very long to learn and to train. I talk about that. It's very important. Before an osteopathic treatment, it's important to have a medical clinical examination before, because there's no real contraindication of osteopathy, but it's only important to understand that if there is another problem, organic problem, is important to treat first the organic problem. And one problem in France, a lot of osteopathic professionals are able to treat everybody, not with this important notion. And it's very, very, it's in reality the problem between osteopathic professional and the doctors. This is the point of this discord, the point of discord, because it's important to have a medical examination before. It's and if I speak about breastfeeding and the babies in the maternity, it's very rare to have to treat with osteopathy a baby before 48 hours of life. Is only if he's in inability to breast, eventually if he's not able to suck the bottle too. It's very rare. It's an emergency, but all other problems are not emergency, and it's better to treat the baby after 48 of life, because there's a lot of spontaneous increasing during these first 48 hours, and we have to let the baby evaluate alone. The indication, the best one for me is unexplained pain or discomfort, the impossibility to suck without pain for the mother, and it's more important if there's no professional able to help the mother. It's important to understand that the mother is not able to hold the baby too, and it's very often, and it's important to increase the communication of the baby and between the baby and the mother. I show you a photography of two photographies of one baby. The doctor examined the baby, all is okay, but look extremely with a precise view. The head is on the right side. The head is in the thorax. There's no, it's very important to see that. And you see the thorax in this, in this direction, abdomen other direction, le bassin other direction, and you see Z, okay? And the head is on the right side, and the arm is flexion, and this arm is extension. Normally, it's, if I look at the arms, the head must be on this side. You know, this reflex is important, and you see it's inversé. Je ne sais plus comment on dit.
Upside down?
Ouais, yes, thank you. And you see on this, the head is the same side as the inferior limbs, okay? And normally, when the head is on his side, the limbs are at other side to be in balance. And you see the imbalance of the body, the baby rule on the right side is unable to be other side. And very often, everybody don't make attention about that. But it explains why in one side it's easy to take the breast, and the other side it's very complicated. Okay, and it's very simple. But if it remains in this position, it's because it's blocked. Okay, and we have to relax that. I show you 4 studies only to have notions about these studies show the interest of osteopathy with the academic construction of these studies, okay, and about cerebral blood flow, evolution of brain structure before and after manipulative treatment, and the same studies have been made for meditation, for hypnosis, and it's the same now for osteopathy. And you see the point. I talked about these points before. And if you want to know more, you see this Ceritelli, Francesco Ceritelli, Sichiti, and Tamburella, and I know another one.
Hello, Dr. Christopher. We can't hear your voice.
Hello, doctor. We can't hear your voice.
Okay, maybe write in the chat that we can't hear him.
Christophe, il y a ton micro qui marche pas. Non, sur le... T'as un petit micro sous l'écran et il doit être déconnecté. Ah ben oui, il peut pas m'entendre.
Et là, je le réactive
Bravo. C'est
et ça
comme ça.
marche?
Oui.
Ça marche? Ah ben voilà. Ah ouais. Donc, there's only one study in France about osteopathy. You see the edition, March 21 this year. And I was at the beginning of this study because osteopath, professional of osteopathy come from, was in Bordeaux, see what I do and go in Nantes. And after 2 or 3 years, 2 or 3 years later, they organize this study, and I go in Nantes to help to prepare this study. And they look at the endpoint who was breastfeeding at 1 month. They don't see any difference, but at this time, I don't know what what I explained before to you. The mother was not treated with the baby. She doesn't know, and she was not present at the side of the baby. And I think for breastfeeding, it's I say directly, it's stupid, because if you want increase the communication of the baby and the mother, if you treat one and not the others, there's a big problem. And it's necessary to treat together mother and baby. And sometimes it's necessary to treat the father too, because there is interference between in the family. It's natural. And the second problem is osteopathy was structural. That means for me the first level, and it's not a good idea to treat a baby with structural osteopathy. Because why? Because simply
Hello, Christopher. Same. Hello. We can't hear your voice again.
Le micro. Ah. Non, le micro fonctionne pas. On t'entend pas. Christophe, le micro. Non, il marche pas. Non.
Et là, marche
Oui.
pas? Oui?
Oui.
Yeah.
Là, il
Yes.
Bien.
marche.
Très
Ah,
bien.
ouais. Donc, I said that the treatment was structural, and it's not a good idea. The baby is water, and water, and the osteopathy, the useful osteopathy is this, that the English men help say smooth touch. Okay, very smooth, and in the listening, what I said before, and the mother was not included in the treatment, and it's not a good idea if we want to increase breastfeeding, because breastfeeding, the first point to have good breastfeeding is a good communication between the baby and the mother. And if you treat one and not the others, you increase the trouble of communication. It's not a good idea. Okay, it's simple. Donc, I think it's important to make a study again in treating, and it's important to treat the mother and the baby together, as if if there was one body. Okay, as at the beginning, and it's important to make a smooth touch, to listening with the hand and not to act. And it's important to make this difference. At the end of this talk, I propose now a study, and we have the number to include, calculated from the two first evaluation, and we are preparing a study with 80 DIAD mother baby, 40 in each group, and the inclusion criteria will be pain score over 7, 8, 9 or 10. It's important to remember that 8 is the average score for fracture pain, donc it's very important. Okay. Osteopathic treatment, smooth touch for the baby and or the mother. It depends on what's happened during the treatment, and we have the intention to use Zelen design, and the randomization is before the proposition of treatment. Randomization is no treatment, and we propose only survey for the group, non-treated group, and survey and osteopathic treatment in the treatment group. And I have these two bibliography, and you see this study. It's the same construction for a study, and it's possible because most of the patients, if they are not in the treated group and they know they are not treated, don't have a abnormal comportment, and you see half of the patients who have not the treatment decide to go to the osteopath after leaving the maternity, and it's very difficult to do studies, you know, and it's the reason why the best way is one group don't know the other group have a treatment, and the randomization is before the proposition of the treatment. And it's possible. There's a lot of studies, and I show one about homeopathy for menopausal hot flushes. Is the same type of studies. What we want to propose, and it's in our research structure, la DRCI, at this moment. It's the end of my topo. There's no slide of conclusion, but I want to say to learn, it's very important to repeat, as in martial arts. It's very important to be more small at each time, and to have efficacy. I remember what Yoda says in a very known story: do it or not, but don't try. I hope everybody knows this this speech of Yoda in Star Wars, you know, do it or not, but don't try. If we are between do it or not it, there are no results. And it's probably the best problem for the treatment generally, not only for osteopathy. It's what I think now. And each year I think more about that. It increases regularly. Thank you for your attention.
Thank you.
I hope you understand what I say.